Hello everyone, my name is Nicole Harling. I'm with the Advocator. This show's mission statement is to educate the community about issues that affect society as a whole. So come right back, we have a great show for you today around autism.
Anybody out there? This isn't right. Why don't you just tell me what I did, please? Can somebody just tell me? God, I should talk to somebody. Let me go.
Hello everyone, again my name is Nicole Harling with the Advocator. We have some wonderful guests for you here. We have Susan Barlow with the Parent Network of Western New York. And we have Dr. Michelle Hartley McAndrew with the Children's Guide Foundation Autism Spectrum Disorder Center at Women's and Children's Hospital of Buffalo. That was a mouthful. Okay. Well, welcome. Thank you so much for coming to our show today. I'm glad we're speaking about autism because that's kind of been in the news a little bit. Start off the bat, what is autism?
Autism is a neurodevelopmental disability that seems to be affecting more and more children. We're diagnosing it more. It is a disability that affects a child's ability to socialize and communicate, as well as involves some of their behaviors, how they engage in some behaviors. Some of them might have very restricted interests, repetitive behaviors, and they might have some sensory sensitivities as well. So this is a disorder that we're aiming to diagnose early as we can identify them in children with these particular characteristics.
Okay. What are some, how would a parent know that their child or children has autism?
Sometimes it's hard for the parents to actually pick it up, especially if it's their first child. But some of the signs that they might pick up early on is if their child isn't really kind of having that back and forth. We call it reciprocity, where the child might make a sound and the parent makes a sound and the child makes a sound back. There might be some smiling or other kind of kind of back and forth emotional response. Usually you should be able to see something like that around 9 months, 12 months, maybe even some pointing, gesturing. Even if there is some language delay, any language delay doesn't necessarily mean that there is autism, but usually if there is some language delay, a typical child might try to make up for their communication in some other way by pointing, gesturing, being able to wave, or up for, raising their arms for up. And so some of those, they should be able to start to develop by about 12 months. If they don't have any words at all by 16 months, that might be more of a concern. They should be able to start to put two-word phrases together by about 24 months. So if any of those things are, if you see any of a lack of that happening, that might be a sign.
Is it hereditary? Because you mentioned that for the first child, you may not know. They may not know. Let's say they do have a first child with autism, they have a second one. Is it hereditary? Is there anything a parent can do to prevent it?
Well, that's a kind of a lot of questions there.
Yeah.
They do tend to run in families.
Okay.
We know that, so the prevalence of autism right now, according to the CDC, is 1 in 68 American children are diagnosed. That increases to about 1 in 10 or so if you already have a first-degree sibling, if there's a sibling. So the chances of having another child on the spectrum increases. So there is certainly something that is genetic. We know from twin studies that they're, comparing identical twins to fraternal twins, that there is more of a correlation in the identical twins. So that gives us information that there is some genetic component, along with some other environmental trigger that happens before birth or during pregnancy. You asked whether parents can do anything to prevent it. At this point, we know that it's early on in the development of the brain, that in the genetic programming, that something happens, whether it's the genetics themselves, the epigenetics based on all the other things that go on, the signaling, and then some confounding environmental factor. There is some research that suggests perhaps folate. If moms take folic acid and folate, that might be, one of the things that they could do to prevent, just like any other kind of neural tube defect. It kind of goes along that if they take folate, so there might be some something to that research as well. But as far as we know, there's no definite any sort of definite intervention that parents can.
So hereditary, environmental can also assist with it as well. Do you see in your studies that autism is more prevalent in different parts of the country? North, south. I'm speaking of like weather. I don't.
Right. Yeah.
Just,
not necessarily. There are some studies that have looked at certain zip codes and whether or not there are different, environmental factors around there. There's some neurological disorders like MS that definitely have a definite area. At this point, there's nothing definite as far as where you live. Are you going to have a higher risk of having a child on the spectrum?
But I want to make sure the audience knows that if your child is diagnosed with autism, they can still live a productive life. Am I right?
Absolutely.
Absolutely.
And I think, and I mentioned that earlier in the segment, that I know sensational things happening in the news with a unfortunate tragedy in California, and that young man was diagnosed with Asperger's, which is kind of an offshoot of autism, but it's not autism, and there's different degrees of it. Is that correct, of the disease?
Yeah, that's kind of tricky.
Yeah.
So under the DSM-4, which is the Diagnostics and Statistics Manual of Mental Disorders that's sent out by the American Psychological Association.
Big book.
It's
Big name.
Right.
Big name.
The fourth edition, they had the diagnosis of autism spectrum disorders divided into 5 different disorders. Autism was kind of the overarching disorder, and then there was something called Asperger, something called PDD-NOS, which was pervasive developmental disorder, not otherwise specified.
Big words to go with the big book.
Big acronyms, yeah.
Right. And Rett syndrome and childhood disintegrative disorder. So what they did with the DSM-5 that came out last year in May 2013, they ended up taking autism, Asperger, and PDD-NOS and really kind of combining, important parts of them, and then, kind of putting levels of severity. So we really don't have Asperger as a diagnosis anymore.
Oh, okay.
According
Would you
to
call
the
it
new
high-functioning
DSM-5.
autism? What would you? How would you?
Call it, now at this stage we call it autism spectrum disorder level 1.
Level 1.
Levels based on how much support we think the child is going to need. Level 3 meaning a high level of support, and level 1 meaning they'll need some support, but not as substantial.
And that's what I want to kind of get into with Susan, is that support with children with autism. Hold that thought, 'cause we're going to come back to that. I want to talk about what support is out there for children at all ages that your company does. So be right back and we'll get right to that question. Hello, everybody. Welcome back to the Advocator. We have our guest here. We're going to call you Dr. McAndrew. Is that okay? And Susan. Before we left off, I wanted to talk to Susan about the different support network that's out in the community to help with children that has autism. But before we do that, though, I want to get back to the doctor here because I want to clarify a little bit about Asperger's and what it is and what it isn't. So take it away, because I think that's very important, particularly what happened recently.
Right. We're kind of going back to the Sandy Hook school shooting, which I think now was back in December 2012. He had a diagnosis of Asperger. However, he also very likely had another mental health disorder. And I want to stress that if a child has a diagnosis of an autism spectrum disorder, does not preclude them from having any other mental health disorder. So, children with autism do not, they're not violent. They don't, a lot of times, any time that they do have, an emotional outburst or something like that, it tends to be very isolated, doesn't involve kind of elaborate plans or anything like that. So I think that's really important.
Yeah, because I don't want, the young gentleman that unfortunately killed those folks in California, they listed him as narcissistic, possibly, and has, autism, Asperger's. I don't want to put all that under one umbrella to say, that's why, because there really is a lot of different things. And I think sometimes as a society, we try to find that one, that's the reason why, but it isn't just one thing. So I'm so glad that you emphasize that. Just because you have autism, it doesn't mean that you're going to be a violent student at all.
Exactly.
Right.
However, it is important, though, to get help or to get support for children that do have autism. And how does your agency do that?
Well, first of all, I work at Parent Network of Western New York.
Thank you.
And we're located at 1000 Main Street on right across from the hospitals. We're right in the medical quarter. Our agency provides services to families who have children with all disabilities, all ages. And we work very closely with school districts and other community agencies and healthcare providers. We wrote and have had a grant called CASE. I'm going to hold my brochure up. I hope I have it. And CASE stands for the Center for Autism and Support and Education.
Great.
We did so together with a group of agencies and also with the hospital with the idea that it was a one-stop shop for families who think they may have a child who could be diagnosed, or maybe they already have a diagnosis of autism and they need to learn about, well, what is it? And often when families go to your clinic to get a diagnosis, they're somewhat, shell-shocked.
Right.
I just found out my child has now the diagnosis I was probably maybe in some ways fearing that I was going to hear. And so anything after that, they don't necessarily absorb. So we actually have a newly diagnosed we have a course for for families who have a child that was newly diagnosed. We have a list of all kinds of topics and workshops. We do them in different locations. And the people who provide those workshops are people who I would consider experts in the field.
And you mentioned too, you do over 300
We
workshops?
do about 300 workshops a year in Western New York.
That's at no cost.
At no cost.
Serving all 8 counties.
To serve all 8 counties, and we have a couple of specific targeted funding sources that just fund the city of Buffalo.
Great.
And we also support families in a couple of other ways. So, for instance, you could call our office and speak to somebody one-on-one and ask questions. I just found out my child has a disability, or my child was diagnosed with autism. What do I do?
You have a great one-on-one support.
Yes. And then, so we also have the workshops, but we do support groups specifically for families who have children who have a diagnosis or they suspect have a diagnosis of autism. So we do a support group, 2 of them in Buffalo. One is just geared for young parents who have kids probably from like birth until 12 or 13. And then we have one that's specific for parents whose kids are 14 and older who are starting to transition from school to adulthood. And then we hold a workshop, a support group in Olean and one in Niagara Falls. And they're
Great.
monthly.
Okay.
And all the information for them is located right on our website.
And what is that website?
It's www.parentnetworkwny.org.
Okay.
And there is a separate, what they call URL for case, but I don't have, it's on here. You can also get it from wnyautism.org.
And we'll make sure that's on the screen so all you
Okay,
guys
great.
will know what's going on with
Great.
that. What's the phone number for parents to call?
332-4176.
Okay.
And that'll take you directly to our information and referral folks who will listen to what you're calling about and making a kind of an assessment as to where to send someone.
Okay.
So when, for instance, if you call us and say, I'm concerned, I think my child might need to be evaluated for autism, we'll send you over to Children's. As there are other places we may send you. We may give you a little list.
Okay.
We're very careful about giving people lists instead of just sending people to like one provider. So, and then we'll also give information on what kinds of questions you can ask.
Absolutely.
So support is important.
Can you tell me what's some of the main questions that somebody may ask? Well, you hear a lot.
Well, where do I go for services? Or how do I work with the school? I'm really concerned. I don't think my son's teacher really understands his behavior. Or what is this committee on special education? Because now I have my child's being classified for special ed services. Or what doctor should I go to? You know, how do I deal with the behaviors? That's a big one.
How do I deal with behaviors?
Yeah, because let's face it, there's one of the characteristics of people who have a diagnosis of autism often can be that they have behavioral issues that need to be managed. And sometimes families have, I mean, you give birth to a child, now you're expected to know how to deal with how to manage their behaviors and help them their behaviors go away.
Absolutely.
There's a whole lot to know.
Okay. Well, we come back. What I want to know is there medication for autism? I want to know about some of the breakdown of some of the children that have autism. Is it broken down by race and so forth? There's a whole bunch of questions I want to ask these 2 young ladies. So come right back. We have a great conversation going here surrounding autism. We'll look forward for you to come right back with us. Hello, everybody. Welcome back. This is Nicole Harling with the Advocator. We have our guest here, Susan Barlow and Dr. Michelle McAndrew. Thank you so much for coming. Diagnosis of autism. Where do they go for that? Where do parents go for that? I should say that better.
There's a number of places in the community that they can go for a diagnosis. One of which I work at Children's Hospital. It was the Autism Center was funded by the Children's Guild Foundation grant and through Kaleida that made it possible for us to diagnose children early, regardless of their ability to pay. So we assess the children. We get them in quite quickly. We don't, very proudly, we only have, a few months a wait list. A lot of places actually can go several months, but when the diagnosis is so, it's important to get the diagnosis and the intervention early that, we really try hard to get them in. And so in order to do that, we do have 2 intake clinics where we just see brand new patients. And we know that autism isn't easy at this point. We don't have a nice test, objective test that can diagnose it, but we really, we know it's not easy to get to know a child in a half hour. So we really try, we have 3 different evaluators that will assess a patient. So it's almost like a couple of different doctor appointments all in one, where the child will see a neurologist, a developmental pediatrician, and a psychologist to really, kind of get all of our assessments. And if we all feel that, we've kind of we feel that this patient, because the biggest barrier that we have found in diagnosing children is that they get bounced from physician to physician. I'm not sure if they're on the spectrum. Let's send them here. Well, I'm not really sure.
Is that kind of like what you were saying too? They don't know where to go, where to ask. So they're like,
Absolutely.
I don't know what you're talking about. I'll go down. And go from
It's
there.
important to go to an expert.
Yes.
No matter what we're talking about, it's important to go to an expert because otherwise you could have Joe Schmo doctor who may not know all the details. So that's why we say.
And it is a difficult diagnosis because you can have children with speech delay, attention issues, just
a whole litany
introverted
of things.
personality. So it's not easy. So we really try to be quite thorough in our evaluation. We do a number of questionnaires, and we also do an ADOS, which is called an Autism Diagnostic Observation Schedule, which is a little bit more of a kind of an objective scoring system in how they respond and interact to different stimuli. So
there's no blood test for it.
There's no
no
blood test for it.
Which would make it a lot simpler.
Yeah,
right?
Yeah. One thing we were talking about before the show started was autism and races. And I'm not an expert in autism, but you don't see a lot of children of African American descent or Latino descent with autism. Doesn't mean they don't have it, though. I just want to make sure.
According to the according to the studies and the literature out there, it's been a little bit conflicted, but as far as we know, there is no difference across ethnicities and races of the prevalence of autism, but the sense is that it's being picked up a lot less in certain ethnicities and races just because getting the knowledge out there, making sure that they're aware of the signs, that kind of thing, and then just kind of coming forward for help and what's available.
So it's important to know those signs to reach out to see, does my child have this disease?
One of the things that Michelle talked about was early. Early as possible to get a diagnosis, because the earlier there's a diagnosis, the quicker we can be providing services and supports. And my understanding is the earlier, the more impact we can make in terms of kind of helping with those behaviors and also language.
How do you treat, I didn't even ask that, how do you treat children? Medication? Talk
There's a Pandora's box right there.
So there's the medical literature, the one that has really been proven to improve outcome is early intervention. It really improves their socialization, their ability to communicate, their ability to learn by getting those interventions in early. And by interventions, we mean speech therapy, occupational therapy, behavioral intervention, sometimes ABA therapy, sometimes
ABA?
different.
Yeah, I was going to ask you that myself. Yeah.
It's a certain philosophy of teaching applied behavior analysis. There's also a floor time approach where you kind of let the child kind of follow their learning pattern. So there's different philosophies, and different children kind of gravitate towards one and might pick up.
I saw something just recently regarding music. It's like how children will with music and start. That's again. I don't know if it's a offshoot, but
There are many different treatment options, and some of which are very controversial. And in families, when they make a decision to go with a treatment option, it's almost like becomes their religion. It's hard, and one of the things that we do as part of the CASE grant is to educate parents and families about not necessarily which option they should go to, is understand what kind of capacity they have within their family, what kind of support they have, and really take a look within before deciding. And also to know what kinds of questions to ask, because you could think that you have the capability to use one type of treatment option, and in fact, you may not have that with the equipment internally and in your family to be able to do that. So there's lots of treatment options, and some I wouldn't refer my dog to.
okay.
And there are some that are highly regarded, research and evidence-based, that could work as well, but some of them just don't work for some people. So it's important for families to learn how to make that decision.
And the key, of course, is early diagnosis.
Yes.
Look at the signs, which, if you can repeat one more time, what are just a few of the signs if you have a young child and your first child, like, something doesn't seem right?
Okay, so a few of the signs. Looking at sort of that back and forth kind of, imitating sounds, back and forth, smiling, those kinds of interactions by maybe 9 months, 12 months, they should be starting to gesture and point and sort of looking to what we call conjoined interest, togetherness, looking at, sort of a similar activity at the same time.
Right. Well, ladies, thank you so much for coming in today. I learned a lot. There's a lot more to learn as I learned today. So please reach out to Susan or Dr. Michelle, and early diagnosis is the key. So thanks so much for coming to the Advocator, and I will see you next time.